The first COVID patient to get a double lung transplant continues to recover. Her name is Myra Ramirez. She's 28 years old, and her family says she never smoked. She followed stay-at-home orders, but she did come down with COVID-19, and she had to go to Northwestern, who says she spent 6 weeks in the COVID ICU there on a ventilator and on a life support machine known as ECMO. Now, she survived, but her lungs did have irreversible damage, and Northwestern says her only chance of survival was a double lung transplant, saying for a time she was the sickest patient in the hospital. I talked with Dr. Wilson Tsai, the director of thoracics at John Muir Health, about this first ever procedure. We're thinking this is the first of its kind. Were you expecting that this would be where we were headed when we were talking about all the respiratory problems with COVID patients?
Yeah, I had a feeling, that it was probably something that was going to be entertained and achieved. But again, the patient selection was probably not going to be as vast as we thought, as we think it may be. So you really want to make sure that there's a select number of patients, or the population is correct for that lung transplantation to occur.
Right, because it's complicated, and there's so much that we as lay people do not understand. So let's just pull up for a second the x-ray that Northwestern put out to show the problem with this 28-year-old's lungs. What are we seeing in this x-ray? Explain what I'm looking at.
So you're seeing extensive damage to the lung parenchyma. So what you're seeing is the fact that when we see chest x-rays, we should see a lot of air enter the actual lung. And right here. So
is that what we're seeing on this side?
Correct. Well, you're seeing very little air in that right lung, and you're seeing not as much air on the left side. Number one, I think it was miraculous surgery. I think these, the surgeons there did a phenomenal job in saving a life. I think the understanding, of course, is, despite how lung transplants, many patients still have a significant long road to follow, or long path to take.
Now, the patient had to test negative for COVID-19 before they could do the procedure, but 48 hours after she did, that operation took place. Her family has started a GoFundMe to help pay for her care.